Hey, Dr. Cameron.
Hey, how you doing?
Doing so good. How about yourself?
Just peachy, thank you.
Thank you. So, Dr. Cameron, this commenter left a comment about hyperthyroidism.
I read that comment and I can't really fix this, but I can maybe hopefully shine a little bit of light on it. Hyper or too much production of thyroid is a disease called Graves' disease. It is considered an autoimmune issue, and it's probably one of the most difficult problems in endocrinology to treat, because at the end of the day you have to suppress the thyroid so that you're not making so much T3 and T4. The problem is, and this individual talked about other tests like a red and white blood cell test. Those are very common, maybe a comprehensive metabolic panel, but really it sounds, at least from what I read in the text, was that there's been a definitive diagnosis of Graves' disease. So the considerations from my perspective is how to calm the immune system and make the immune system act more appropriately. Do the things that it's supposed to do without doing things it's not supposed to do. And one of the best ways to do that is, and I believe I've talked about naltrexone before, but low-dose naltrexone, finding somebody to prescribe low-dose naltrexone will help any autoimmune issue. And even though naltrexone, by drug class, is a opiate receptor blocker, so it blocks the opiate receptor site, and so people that are addicted to opiates can't enjoy the high that they would normally feel on the opiate. But that's in higher doses, 25, 50 milligrams sort of, or higher doses. We're talking about doses, and I encourage you to look on the internet and just type in the keywords low dose naltrexone, NAL naltrex, TREXONE. And you can see that it's used off label by a lot of functional medicine people like myself for autoimmune issues, and there are other things too, like pain syndromes and things. But what it basically does in a nutshell is it helps the immune system gain an understanding of what it should be doing and what it shouldn't be doing. It helps in that way. So for example, I've got a lot of patients over the years that have had autoimmune thyroiditis, which is, the other word for that is Hashimoto's thyroiditis. And when I was in nursing and medical school, I was taught that once you have an autoimmune issue, you're always going to have that autoimmune issue. You're never going to get rid of it. Well, if that's true, then why do I have people now who had Hashimoto's, but now their TPO and TG antibodies are within normal range? So, and they achieved that by doing low dose naltrexone. So I encourage this individual, don't give up hope. Graves' disease is a complicated thing, and I apologize about that. It's a tough place to be. It's a hard place to be. But at the very least, you can do things. There's a lifestyle, what we would call an autoimmune lifestyle, which basically means getting a lot of the allergy forming foods out of your diet. Gluten, dairy, wheat, corn, soy, peanuts, and egg whites are the top 6 statistically, but I have people that have autoimmune issues start with wheat and dairy, modern wheat and dairy. So if you're going to do some type of grain, have it be an ancient grain and don't eat a lot of it. They turn into sugar. They mess with the immune system. And low-dose naltrexone, a lot of functional docs like myself, I prescribe low-dose naltrexone, maybe not every day, but at least 5 to 10 times a week to my new patients that are suffering from some form of autoimmune issue. So that's not really helpful, and I apologize to the person because Graves is one of the most frustrating things to have, because you basically have to take total control over the thyroid and suppress it, and then you'll go into a hypothyroid state, but that's easier to treat than Graves' disease is. So you're on, there's 2 drugs, you're on probably one or the other of them to suppress your thyroid. And then of course from my other videos, what I would then run after have been treating for Graves for a while is I would run TPO and TG antibodies just to make sure you don't have Hashimoto's as well. And then I would run the free T4, the free T3, and the reverse T3 in the morning, depending on if you're on medication or not. If you're on medication like levothyroxine or something, you take the blood 4 hours after the morning dose. And get yourself on, as soon as you watch this video, get yourself on the internet and just type in low dose naltrexone, and you're going to get a lot of hits and a lot of really good information.
Perfect. Thank
Good
you
luck.
so much, Dr. Cameron.
Betcha.
Come visit Cameron Wellness and Spa located in Salt Lake City. Meet our wonderful Dr. Cameron.
Thanks, Bye, guys.
Bye.